en inglés. Hola, buenas tardes, Lina.
Bien, bien.
Joana por acá,
¿Cómo está, Joana?
pateando de emergente en el Zoom.
Mire, pues me hubiera dicho para ayudarla.
U- ¿Usted está en la Universidad del Istmo o está en la
No, yo estoy virtual.
está virtual?
Sí, no
El
sé si
retraso.
sí, qué raro. Yo creo que ella mandó una foto. Yo vi que mandó una foto.
No, bueno,
Es que le iban a hacer en un salón, pero qué raro. Ya me escribí, ¿verdad? Voy a preguntarle si no se va a transmitir.
no, sí se va a transmitir, tienen problemas con la computadora. Ya le escribí a Ivonne de nuevo para
Ok,
ver.
bueno.
Ya, se pone vivo. Hola, buenas tardes.
Hola. Hola.
Buenas.
Disculpe la tardanza, hemos estado usando con la tecnología. Buenas tardes. Esta reunión de hoy la va a presentar la doctora Arlene Calvo, ya que es una invitación sobre todo de la Universidad del Istmo. Y le damos la bienvenida y agradecemos la presencia acá. Bueno, gracias. I'll say it in English y en Spanish. Bueno, ante todo, muchas gracias por acompañarnos a la Universidad del Istmo, a la Reunión para la Reunión y a Ciencia en Panamá. Thank you for being here. Voy a presentar a nuestros invitados del día de hoy, empezando por nuestra invitada internacional, Monica Trigg. Ella acompaña de la Universidad de Emory y es estudiante de doctorado de salud pública de la Universidad de South Florida, ya pronto a finalizar su estudio. Ella se unió al equipo de Presencial en abril de 2013 en Emory y ha estado trabajando proyectos relacionados a prevención, modelados, vacunación, y también temas de mujeres trans, hombres que tienen sexo hombre, y estos temas de alto impacto. También estuvo laborando en el Centro Carter, donde pasó unos 6 meses en Sudán y también en Latinoamérica con el control del glaucoma. Así que le damos la bienvenida. Y el doctor Arturo Rebollón, nuestro colega, es el decano de Ciencias de la Salud de la Universidad del Istmo, exalumno egresado de la Universidad de Panamá, médico, y también cuenta con la maestría de salud pública de la Universidad de South Florida. Así que para nosotros es un placer tenerles aquí. También estamos acompañados por estudiantes de salud pública de la Universidad de South Florida que están realizando un curso en Panamá. Así que muchas gracias y le paso la palabra a Monica.
Vamos a agregar todavía la presentación.
Hemos estado teniendo problemas técnicos el día de hoy porque ya estamos resolviendo, ya vamos a poder proyectar la presentación. Veo que nos acompañan de lejos también. Vamos a dar inicio con el doctor Arturo Rebollón, que está tratando de sostenibilidad y las tendencias en el mundo actual, en la industria. No veo la presentación.
First screen.
El tema de hoy general es el tema de salud de la mujer. Tanto Mónica como Arturo va a estar hablando de los distintos aspectos que afectan a la salud de la mujer. El doctor Arturo va a estar hablando sobre el desarrollo sostenible y cómo esto afecta a las mujeres. Y Mónica va a estar hablándonos sobre el impacto de la pandemia en mujeres en Latinoamérica. Así que es un tema muy importante para nosotros y espero que les guste. Las charlas se van a realizar en idioma inglés.
Gracias. Thank you, Arlene, for having culture student from the University. It's a great pleasure. As a alumni, I'm very proud of learning everything I did at the University of South Florida. I'm very grateful for having Arlene as a mentor because she's been guiding my path to everything that I do right now. Started with doing very real research and understanding that we need everyone to be glad. That's why we're focusing the conversation today, something that I talk about reaching a sustainable level status. And before we start with this situation, this presentation, I want to give you a little story. There's so many people and Ana is an indigenous lady. She lives in Santa Fe, which is pretty much like 300 kilometers from the main city, Panamá city. And she discovers a bump, a little lump in her breast. She doesn't have a hospital nearby. The closest hospital is 80 kilometers away. There's no transportation. She has no money to get there. She is the mother of 2 kids. Without a husband, so she has no support. When she finally manages to get to the hospital, she's diagnosed with a breast cancer at stage 4. There's very little that we can do about it. I wish this is such a story, but this is something that is happening. Anna is a real person. She died while doing this analysis. And she is one of the girls who inspired all the work that we're doing right now. When we talk about reaching sustainability in the women's health, we always think about the SDGs, right? The SDGs, we all know about all the SDGs, especially when we talk about women, we try to focus on, in women's health, we try to focus on these 6 areas. The poverty, good health, SDG 3, quality education, gender equality, decent work, and of course, reducing the inequalities. All of these are just the basic ones that when we talk about women's health. Specifically, we're going to be focusing on the SDG 3.4, which is the most important for my job, right? That is reducing mortality of any non-communicable diseases. We're targeting specifically cancer in all females. In Panama, we have one hospital, the Panamá, the National Cancer Institute. They cover 50% of the population. And what happened to the rest of the 50%? They donated to the hospital. 1 out of 6 patients with cancer, they get diagnosed by autopsy. Do you know what does that mean? That we only know that they get cancer when they die. So we know that it's really late. And according to the SDG, we have to reduce the mortality by 30%. However, when we start looking mortality in the past 20 years, it haven't changed in the 20 years. So what we're doing right now is not enough. That's when we have to start to go something that we like to call sustainable. We have to focus on 3 pillars from the health, the World Health Organization that are targeting innovation, equality, that are focusing on public policy, and that means that we have to get out of our company. I know that you're doing your MPH right now. MPH, and I heard that she's going to be, you know, MPH. Infectious disease, and all about cancer. And that's the STD that you're going to be targeted. However, in these non-communicable diseases, I don't know in most people, especially in this situation. So we have to target everything that people understand. Release. Now we have to find them fast. We have to get them to the health center fast. And we have to get them treatment fast. That's the priority for the World Health Organization. And why we're doing this? Because right now the inequality for mortality is very, very. For example, in countries with high people, we have a 90% survival, 5 years survival rate in breast cancer. That's amazing, right? That's how to be everything. However, when you come to low-income countries, they don't have that same. They're reaching between 66 and 40% survival. That means that half of the women are dying on something that if they live in another country, they will have survived. So that's why they have to target all these pillars to reduce the organization. And how are we doing this? We collaborate. I only work in academia, I also work in the industry, the pharma industry. We're pushing this with their own expertise with Esta. We also have collaborated with international students, NGOs, and there's one NGO in particular that is called the Panamá Association for Cancer, for the control of cancer, and we're doing something. We're pushing the navigation program. Have you ever heard of navigation? Navigation program is a system with volunteers that helps the patient reach from the diagnosis to treatment. And even before that, here we usually understand this as the navigation. However, understanding that we have to put more in the community level, we have to do awareness at the community level. We have to do awareness through campaigns, through community work. We know that all these mass media campaigns, social media doesn't have any impact in the mortality. And why? Because we saw the data. The data says that we haven't changed mortality in the 25 years. And if we bring, let's say, the Pink River campaign in Panama, there hasn't been any impact in the mortality. And that's the actual outcome of it being awareness survey. Create awareness so they can start the route earlier. That's why we're partnering with academia, with NGOs, with pharma, with huge organizations like the UN, the Women, to try to help them reach it. And there are several barriers that you have to understand, because not just because there's an NGO that everything is going to happen really fast. There are several barriers to reach, for example, the policy barriers, access barriers. Like I told you, land, TV, $100 from the closest number. So that's no access. No access for that. Location, those who work in epidemiology understand this better. Where you live affects your health. That's location-based epidemiology, and you use a lot about that for health communication, for planning, and where you put the resources, and how to have access to information. I work with our leading in some indigenous communities where we had to tailor some education materials for those indigenous communities. They didn't want technology, they wanted pictures, they wanted their faces, their communities shown in huge, what they huge literature. We were too eager to do that, but that's what the community needed. That's what they wanted. They have to understand what they needed. And just to tell you an idea of what have we achieved so far in the past 5 years with this navigation. In the first year, we helped restrict them 27. And in the last year, 2022, we helped 900 women restrict. To restrict them, there's still a lot of work to do because these just come from one area, the one where Anders is. We're planning to expand it to the rest of the country. Hopefully, by the end of next year, we will be sending 5 to 6 people to the oncology center. And we have to understand something. In public health, we want to be best of the best. Right? We want, I remember the first time I met Dr. Peterson, I told her in her face, I want to do public health because I want to say it. Sure, it was a dream. I needed the tools to do it, and you said it's a great place to get the tools. And when I went there, the first professor that met me is you need money to say it. That's why you have to understand that the policymakers' language means that you have to talk about pharmacoeconomics. And when we talk about bringing them to the early treatment, this is what we mean. If you take them in stage 1 breast cancer against versus stage 4, we have a reduction, an increase of 100% treatment. And if you, and this is just in the United States, if you take it to Europe, let's say Belgium, that they also have a very health system, it's one of the high income countries, they have low mortality, it's very much the same. It's almost 100% increase in cost, but that 100% represents just the direct cost. The rest of the expenses are the indirect costs, low productivity, low quality of life, all the information that we manage. And that represents the 90% of the economy. So that's why we're doing everything that we're doing every level to reduce this impact, the economic impact in the country. So that's why we're focusing on the future. This is right now and today that we are reaching as a stable system. We plan forward. So thank you. I told Monica that I was going to take 10 minutes for her amazing picture. So we're going to share your presentation. Is what is? No. ¿Dónde se me fue? No. Se fue el muchacho. Ah, falta la presentación. La de. ¿Quién la tiene? ¿No? No, ya tiene. Está afuera en el escritorio. ¿Ah, sí? Sí. Escritorio. Sí. These are live presentation. It's always happens, right? No, it's not. Una vez más. No. Paola que no es. ¿Y el la evolución dónde está?
Es que eso es lo que yo te decía, esa que no aguanta de lo verlos, que no es para comenzar.
Sí. So, when you are in your country, the United States, how far do you be from the cancer hospital? Yeah. So you live in a great city, you have a cancer hospital. How about the people who live in Oklahoma? How far is the closest cancer hospital? It's like a 80 kilometers, right? What happens if you go to one of these amazing nations, like San B, how far is cancer hospital? So this is not something unique to our country, it's something that's happening everywhere. The access to cancer treatment is something but eventually that happens everywhere. We brought some coffee. Have you got some mini coffee? Just give us 1 second.
Does anyone have any questions?
So for example, nobody asked me what is it that I want to be, what I need by it. I work with the largest pharmaceutical company here. We have the largest invested, the focus is the main area of concern, focusing our oncology, neurological diseases, diabetes, the complications of diabetes, leukemia, all these rare diseases.
How are you guys going to make it more cost effective for
That's actually our mission. That's actually our mission. That the mission for us for 2030 is that we have to bring 5 times more innovation. When we say cost, they're reducing not only the cost of the medication, but also the social cost. Like the one that is already 90% being used. By doing all this innovation, implementation programs, because we're targeting to bring more patients into stage 1. We targeted to treat more patients in early stages of hemophilia that we talk about prevention, in breast cancer, we talk about curing the disease, not just treating the disease, we can cure the disease right now. The problem is that in Panama, 80% of the patients come with stage 3 setting, almost just basic, just kind of basic.
I wanted to comment on something. A tendency that we've been highlighting quite a bit in public health is that we have to stop separating non-communicable diseases from infectious diseases. And a lot of these cancers that have infectious etiology, like HPV, cervical cancer, Hep C or Hep B, liver cancer, and so forth. There are several. And we have to start working together these processes in order to have this non-communicable diseases, and especially in our countries where we are exposed to a lot of these infectious diseases.
In Panama, we have actually even though we have what we have is prevalence rates. There's no coincidence. There's a huge coincidence of occurrence of HPV weight.
Yes.
And when I say high coincidence, it's because we haven't done it before.
I haven't studied it.
Excellent.
Is that unusual to? Is that something that has been seen less developed countries? This correlation?
Yeah.
Or does it happen?
Yeah, it's happening everywhere. We know that all these clinical records here is one of the causes of
Everywhere.
everywhere. So, Monica, your turn with Julio.
I'm gonna start sharing.
I'm not sharing it.
Yeah, then get it to the screen. Share the screen. I'm sharing.
Use this. Use slide.
Thank you. So, start by saying, thank you so much, Dr. Cabo, for setting this up. Thank you, Dr. Rebollón, for hosting us. Thank you to my classmates who I'm so happy to have a friendly face with that around me. We're at the very end of a long week, so thanks for staying with us for this final presentation. Given everything that we've learned over the past, a lot of this is going to be clear for you. And I'm going to rely on my notes on those as a speaker. So Dr. and Dr. Cabo introduced me to the folks on the Zoom that I'm an PhD student, and I've decided to focus my research on the impact of the COVID-19 pandemic on women, specifically around agency. And I'm hoping if we have time for this to be a little bit of an exchange at the end. I have two excited about this. I have two presentation aims. First, I'm going to talk a little bit about a systematic review that I did, specifically on violence that women experienced during and following the mitigation efforts around COVID. And then second, I want to talk about a strategic plan guide that I've developed. And I'll talk more about this later, but I'm hoping to get some feedback from the group and from people on the Zoom. I'd like you to put on your 10U are a leader in the development organization, and I'd like to get your thoughts on the second part of the presentation. That's what we're hearing. So first, there are two sort of introductory, make sure we're on the same page slides. One is about agency. So first, I've decided to use Nyla Kabir's definition of agency, which is your ability to define one goal and act upon them. And I use that instead of something like empowerment because it's more comprehensive. The term agency is more comprehensive than the term empowerment, and also development organizations, but it's a more normal nomenclature within that group. And I wanted to know that agency is both relative and personal. So a woman's ability to make decisions about her life will manifest differently, even obviously across the world, but even within a similar culture and even in a similar household. So also agency is not all or nothing. A woman may have a job, she may be earning her own income, but she might not have a say over her own health decisions. So there's a lot of nuance and things that really difficult to measure. And when we get to the development organization, you can already think about it. You will be able to see how difficult it is to integrate gender in this systematic thinking. Just this next slide. So my research I've oriented around a systems thinking framework. There's a lot of really good resources on systems, but I've created a really simple diagram here that breaks, for this context, agency into the inputs, which I have here as formal systems, government laws, informal systems, culture, religions, norms, and external systems, which I have here as global development agencies. Those influence the stock or agency. So if you think of like the person who wrote about this, Mel Meadows, did this fantastic book where she uses a bathtub. So the inputs into the bathtub creates a sort of amount of water, in this case, agency, which then affect the outputs. And for my outputs, I'm focusing on economic and health. So women's access to income, ability to earn income, for access to make decisions about healthcare, that kind of thing. So all of these factors influence agency up and down that affect the outputs. These loops at the bottom are common within a systems thinking framework. On the left, the balancing loop, you might not be able to read it, but a balancing loop works to restore or maintain stability. In this case, it would be like a return to normal after COVID, sort of brings things back to a calm place, versus the reinforcing loop are sort of exacerbated situations or leads more chaos. And in this situation, you can think about COVID variants, ongoing economic uncertainty, and possibility to just sort of keep things kind of crazy. So those are the framing concepts that I wanted to start off with. So for this review of types of violence experienced by women, I really wanted to look at it from that systems thinking approach, a holistic approach of the different inputs that create or impact agency among women. So you see, like for the individual socioeconomic framework, the individual is affected by multiple layers. At the societal level, we have systematic violence, which includes government practices. We've learned a lot about the presence or absence of laws and policies that may or may not be upheld. This also includes cultural norms and religion. We talked about all of them, and this region more broadly. At the community level, we have public violence, which is violence that women face when she's out in her society, whether it's social media could be, well, social media could be one. actually, it might be a later slide, but thinking about a woman being out in the public, whether she's being gawked at and sort of like microaggressions to be attacked. I do have another slide on this, so I'll stop with that. And then at the household level is where women are more commonly experiencing domestic and intimate partner violence. And again, that's a huge range of access to resources all the way up to physical, violence. So each one I have unpacked a little bit. I won't talk about a whole lot about them, but examples of systematic violence. So this all came from research that I did, that Dr. Fellow and I and others wrote a manuscript. Review. So in the societal level, lack of policies, austerity measures, there was actually a lot in the literature review that I conducted that was talked about austerity measures, and those are funds that go into public assistance programs. So even before COVID started, there was a lot of pulling back of public assistance programs that assist women in need, whether it's medical support or childcare availability or like food programs, those kinds of things. So a lot of those had already been pulled back that really impacted women once COVID hit. The cultural and legal restrictions to reproductive health care, we talked about that when COVID hit. The birth control bill is common in this area, and we're going to be closed. She couldn't access for reproductive health care. And then of course, cultural norms dictating women's caregiving responsibilities. I'll talk about that in a little bit, but women were expected to go home and take care of those. Quickly, the community level, the public violence, women experience increased vulnerabilities, including, this is what I was speaking about earlier, verbal harassment all the way to femicide, which we heard about. And the different gender assigned lockdown measures shed light on mobility patterns. So some of the research that came out of this, like Panama had days when men could go out and days when women could go out. And on the days, women were pretty adherent to that. They were like on GPS surveys that were done versus men on their days, they just kind of got where they wanted to. And so more often. And so when you think about vulnerabilities that we face in public during something like COVID, if there's men that are already being non-compliant to the laws, it increases the threat of violence that we face on the street during COVID. And then finally, results from the review that I conducted showed that as we all know, lockdowns led to an explosion of reports and abuse. Hundreds of percentage passed in the first week even. And they went into kind of waves as people experience economic and other mental health stressors that were related to being locked down. And we know that these reports of abuse are just an infinitesimal fraction of what was actually being experienced. And then I was really touched by some of the documents or some of the records that talked about this systematic violence that was re-perpetrated, during COVID. If children were in the house, they were all in the house together, and women were being abused, that reinforces the normality of violence that those kids were growing up with. A lot of for women, the needle was really set back during COVID and lockdowns. And so these are some of the key points that I've summarized here. You can kind of look through those, but the review helped bring together that expands the violence perpetrated through multiple levels of society and that are having direct and lasting impact on this agency. And some of these examples I've mentioned include women leaving employment earlier at higher numbers, and they're not returning to work nearly as quickly as they're having to stay home. Women lost access to reproductive services, leading to I saw rates of 1.4 million unwanted pregnancies at a local level. And keep in mind also, we think about unplanned and unplanned pregnancies, but not all pregnancies lead to a baby. That's one of the reasons I was asking about illegal abortions earlier, because we know that that's one of the paths that we can go, which reduce risk her life, and then in addition to that, with healthcare being not as available, there's higher rates of maternal mortality that we're seeing as a result of these unintended pregnancies and that reduction in access to services. So in addition, women also experience disproportionate levels of mental, emotional, physical violence during and after lockdowns. I included this graph here to show that Panama is at the top of this, is at the top of these 19 countries in terms of the GDP difference during COVID. You know, Panama was hit really hard at that in terms of the economic impact. In the manuscript, we included a section on sort of how to move forward on this, and that's really the second part of the topic. And some of the things that we sort of focused on and want to bring out is that this isn't a woman's problem. You know, there's so much that we've been hearing about. It's all focused on women, and there's not enough work being done to recognize that it's a societal problem. Not necessarily a man's problem either. It's the society that creates this cultural environment that the gender reasons for violent behavior need to be addressed. And in some of the other research that I did, there was a series of really good points that talked about the disempowering and reinforcing language that victimhood creates, to really turn to using more empowering language for women. Some resources suggested providing there are a couple of different ways to think differently than the victim mentality. Including the role of government, we do need more policies, but we need to have a lot of reinforcement to make sure that they're holding up. And as we heard, legal systems often fail when there's just nothing happening. And then also, I kind of went on a soapbox about community engagement. I believe it's just really important for society to take care of each other, and this might be our key for us. All right, so now I'm going to move into the strategic plan guide. This guide that I'm going to talk for in a minute was informed by a series of qualitative data interviews that did with subject matter experts for community intersection of gender, agency, and development with this industry. So you can see the same socio-ecological framework there, but I overlaid development, organization, engagement, because development organizations really work individually and holistically. And working in this way is complicated because it takes buy-in from organizational leadership. It can be so difficult to measure and expensive. Organizations, both non-profit and government organizations, are often very siloed. It's really hard to do this in a systematic way. But the guide I'm hoping is designed to help organizational leadership reflect on integrating one holistic approach to integration. So it's designed to be used by organizations who want to better understand the system's approach to gender, to develop a plan to integrate it more broadly, or if they're already working on it, to integrate, to identify holes in their approach. So the guide is a document that the organization would use and read through it and kind of walk through step by step. And so I've broken it down into these 4 sections: foundational, creating the system, really being careful about harm reduction, and then reflecting on the work that they're doing. And each section, each of these big steps are broken down into smaller steps, and then each smaller step has the baby steps. So in the next slide, I have lots of umbrellas. I want to walk us through some baby steps for each of these, and I just chose like a couple of examples, but as I'm walking through these, I'd like for you to think about development at time and think about what works, what doesn't, what's missing, what's wrong. So for the setting the foundation, so fancy. We have 3, these are, so this is the big section, and then the baby steps. I have 3 separate sets of questions, but for this presentation, I'm just including the setting of organizational commitment, which includes sort of big level considerations that an organization might need to think about. Has the leadership caucus even met to talk about what if they want to integrate gender, what gender might look like, what the outcomes and timeline might be? Have they thought about how it might be integrated and the resources needed? There's a strategic, it's not cheap to do this work. The environmental impact, political and stakeholder implications, who will be the leader, whether that's internal to the organization or if they're going to hire consultancy to walk them through all of this. If they've conducted a SWOT analysis to just sort of look at where their threats are, what opportunities they might have. And have they undergone a similar effort in a different topical area? Can they integrate this? And then if there's another organization they can identify that might just, this is what we did, and this could be helpful for us. So these are some of the questions and considerations under this, specific piece. And so there's an additional set of questions for developing a plan and HR. And I just wanted to touch quickly that HR was a lot of fun to do because I got to think about, really explore all of the components of, if you're going to model gender integration, you have to start with yourself, right? So how's the organization recruiting? How are they treating women? Are they giving women, abundant parental leave? Is there childcare available? Are they thinking about ways that they can increase their training opportunities and education? Are they really giving women a path to leadership in organizations? So those are some of them. That was a fun one too. These were all fun. The second big section is to create a system, and I've chosen for this presentation to highlight the government as stakeholders. So that's really, I won't read all these through, but that's really getting organizations to think about how they're working with local government. Are strategies, is there any alignment? Are they already working with them? Is the organization a known and respected entity by the leadership, by the political leadership? Is there untapped leverage that they might look at? Like, how can they strengthen those relationships so that development organization can work really strongly with the government? And this was something that came out really prominently when I was doing the key informant interviews. It's how critical it is for development organizations to have a strong and healthy and productive relationship with the local governments. And so I've included things like to look at projections and scenarios over election cycles over several years. There's one other thing I wanted to bring out. To kind of be clear, looking at how an organization can advocate on behalf of women and girls. This is like in the policy environment, what the government is doing, like how can development organizations who do have a lot of say in influencing the direction the government may or may not go. And there's a whole set of resources for the government also. So also in this section, the stakeholder engagement is much more. It talks about a very wide stakeholders that the organization also needs to consider engaging. The harm reduction section, you see there's 3 little steps there, and this one, again, I said earlier, was the one that it makes me nervous because we go to move the agency forward, and it really can't put women at risk. So this section, this is the smallest one. This section is really unpacked about how, if you're going to program around gender development, or even hire more around gender development, how will you kind of really be careful about the work that you're doing to make sure that there's no unintended harm that's happening from your efforts. I encourage the organization to have external resources to help identify risks, challenges, and successes. And in the face of opposition, which we've heard about in some of our talks, people need to be creative about how they might go forward to either slow down and get the opposition group to maybe get used to the idea that they're doing, maybe change slow, or maybe just taking a different approach, so we've heard about that too. Just thinking about ways to make sure that ultimately the people that they're trying to serve, women, are staying safe. And this one's tiny. Reflect often and carefully. There's just the one having encouraging organizations to really have an iterative approach to considering whether their organizational values are represented all along the way, and they're really reflecting back on that to make sure that they're moving forward in the direction they want to go. So those are the 4 sections. I would love to hear any feedback that anyone might have around overall impressions of the approach, kinds of things that I posed. It was just small sections on each one. Anything any gaps that we saw based on what I shared, and any strengths that you saw or identified that I might understand. So feedback is welcome. That's it. Yes, sir.
First, that's an amazing research. That's what we call research a huge elephant. And how do you do that elephant? You have to take small bites. And you see that. I think that the work that you're doing is great. It's amazing that you're doing the fact that you're separating. It went all the way to the little steps they get to the island. That's actually what we do here in my work, because it's a huge problem. So we have to go all the way to the base, to the root cause. One thing that I would recommend is the use of verbs. The use of verbs, you're using the basic one, like are you, and the answer will be yes or no. And you want to maybe think about it, like how would you, that kind of stuff, because that will change the conversation. We started using those new verbs in my industry just for months, and it changed in the experience. Because the people started to think more about it. But I think that you're doing a great job. I think you have a great answer. So just get you the right.
I have a question. Yes. Online. Should did you study online? Did you study online schooling structural violence? Panama had the longest online schooling. I think so for the world. Personally, my blood pressure went up. Trying to work and help the kids. It still hasn't been a chat. They're online school. So I could question that I look into the opportunities that it's like violence. Answer. Also, yeah, definitely. Because the lockdown many years online school. So who is the responsibility to take care about that? Yes. So that I understand my confusion. And I think that in the paper there's a new section on I sort of included it in gender-based violence because that's where we really have like what are the cultural expectations of women, and it's leaving work has to take there because the exposure they had to COVID because they're that adult taking care of children and the older population and trying to be school or continue working remotely or all of that, and then the mental health. Yes, because there was a reality in that like for most of the women, because the lockdown produced that many kids have school at home, so we had to take care of the kids, and that's her partner, easy working to supply amounts. I didn't include it here, but I saw some. There were studies that did reports on. So women already are at 4 times the amount of unpaid labor. Yes. And then, so the impact of COVID is that the responsibilities and hours spent in labor skyrocketed, whereas this wasn't across the board, because men did step up. But the men's unpaid labor, you know, it's really like. Yeah, thank you for recommending. Yeah. Have you been inspired by the parents that are developed in more equitable countries? Just I didn't look at those for this, so we can't speak. Maybe you wanna, yeah. Yeah, that's sorry. Speak to it. Based on what we've been observing this week and all the discussions we had, the government plays a role in trying to control domestic violence, specifically talking about domestic violence in our country, our gender-based violence. However, we're seeing more nonprofit organizations or taking the lead in these issues. How, based on your strategic plan, do you think we could bring them together to work in tandem in these issues? Well, I think that the role that development organizations play in countries can really benefit government resources and the ability to mobilize people, messaging, and there's a section on in the strategic guide on how development organizations can align with government messaging, including all different kinds of communications. In my experience, development organizations always have an angle of making themselves unnecessary. So being able to hand things over, but that takes time, and as we know, the COVID moved the needle so far back. So I think that for the foreseeable future, that working together in a network to help bring these back up, and then maybe the development organizations can hand things over. Once the government, they may not feel that they need the organizations, but I think in my experience, in most cases, governments are happy to have additional resources to develop organizations, both financial and technical.
And on top of that, and we're talking about the NGOs, I just had a meeting this week with the UN Women, and they have fundings. They have a lot of fundings, but they don't give it to the governments. They give it to NGOs so they can provide the help system that we include the government, and they're bridging that gap in the NGOs, big program, and the government, so they can make this. So it's going through that long time.
And that's a good example of when I was talking about how development organizations can have, you said, UN Women, there's a lot of influence over local governments, and by empowering and implementing programs that are local, it really brings everyone up, ideally, you know, and it's thank you. Hay un anuncio.
Ya, la única pregunta, que había ya la great talk. Reading for Vera Moncada, great talk. Thank you, from France, really late. Yeah. Thank you very much to both speaker tonight. Well, I'm going to switch in Spanish briefly. Para Ciencia en Panamá, agradecemos la presentación de la doctora Monica Trigg y del doctor Arturo Rebollón para la conferencia de hoy. Ciencia en Panamá va a estar en la Feria del Libro en agosto. Del 15 de agosto al 20 de agosto vamos a tener un stand que nos ha concedido la Feria Internacional, la Cámara del Libro, en la Feria Internacional del Libro, y vamos a tener eso como una plataforma para los que quieran participar durante esos días. Lo otro que queríamos comentar es que tenemos varias anuncios de colaboraciones. Entre esas, la Embajada del Reunión, que se acercaron a Ciencia en Panamá, así que vamos a estar promocionando algunos tipos de actividades. con la embajada de y también con Che, que también ha tenido acercamientos con Ciencia en Panamá, y también están trabajando en iniciativas de este. Así que por los momentos eso, y la otra semana, Ciencia en Panamá tiene una sesión de la obra de teatro La Pura Letra en el Teatro Anita Villalaz, el jueves 20 a las 7:30 de la noche, para los que están aquí en Panamá. Y cualquier colaboración, estamos anunciando en el chat general de Ciencia en Panamá. ¿Eso está bien?
Sí. Y un anuncio breve. La Universidad del Istmo está haciendo su primer congreso de investigación. Universidad del Istmo is doing their first research conference, and the main topic is about sustainability and development for the society. So it's open to the whole papers. We're going to be sharing the reports for students. We may say abstracts. We're going to be training people in abstracts. When I work with Reunión, we used to do 5 abstracts. And I started sending everywhere. There was a year that we didn't miss anything, and we had to find the budget to go to all those conferences, APHA. So it's kind of interesting. So we're all welcome to submit your papers for the university. It's going to be really good.
Agradecemos a los que estaban en línea la tarde de hoy, y para cumplir con los horarios, pues vamos a proceder a cerrar el Zoom y agradecer el apoyo, el soporte del grupo de comunicaciones con la grabación de la sesión de hoy. Y de este lado, thank you very much for coming for a long trip to Panama. And I hope that you enjoy this visit to our country, for charming and warm weather. And we'll continue for the next month with other session for Science in Panama. Thank you very much and good night.